Hi, I'm Alex Mitchell and I'm the creator of Cancer Stories. Cancer Stories is a video diary program which is designed to help people like yourself manage their cancer. And the key aim is to record previous patients' experiences, really of a wide variety of cancers. And these are patients who are genuine, real patients from Leicestershire who've given their consent to allow us to record their story onto DVD or the internet. What we ask those patients is really to give a brief account over 30 or 60 minutes. How did they manage with their diagnosis? And hopefully by watching their account, you'll be able to pick out some common themes from one or more of those videos. And those common themes might be things like what resources are available locally or nationally, or how do families cope, or how do people themselves manage with those awkward stages, either the initial diagnosis or the complications of treatment, or perhaps psychological and emotional complications, which are sometimes overlooked. So overall, we hope that by watching the video diary program, you'll be able to take some positives from other people's accounts, and hopefully that will help you better cope with your situation, whatever that is at the current time. Thanks for watching.
My name is Victor Clements. I'm 66. I was born at the General Hospital in 1947. My brothers were born in London and my parents were born in London. My brothers are 84 and 85 respectively. I have 3 children, a son of 38, a daughter of 33 and a daughter of 25, and I have 4 grandchildren. And I live with my ex-wife who cares for me. And I had bowel cancer in August 2006. I'm Victor Clements. I was born at the General Hospital in the winter, April of 1947, the bad winter of 47, and I'm told that the ambulance had trouble getting me up to, with my mother up to the hospital. I'm the youngest sibling in my family. My brothers are 84 and 85, and were both born in London. And my parents moved here to Leicester in 1944, and I came after the war in 47. I went to grammar school and I started working in accountancy in 67. Yeah, my mother had died of cancer in 1967, but I didn't pass my examinations. I got into a bit of a rut, and a friend of mine who I played football with, he was running a market business down in Sussex. And so I moved down in 1971 to live in Sussex, where I met my wife and had 2 children, and I got divorced. And then in 1985, I was made redundant. I moved back to Wigston to live with my father, and finally got a place of my own, and he died in 1991. And sort of for a few years I was looking after the children. Then in 94 I worked in various news agents, and I did that until 2001, and then I was started in Hayes. I was working on the Reader's Digest contract at the magazine, answering readers' queries. And I was okay until 2006. And in August 2006, I started getting these pains in the stomach, because I was off work for 2 weeks. I think most of the time I can remember I was bedridden. And my daughter and my son took me to primary care. Not A&E, I don't know why, it was on a Sunday. And just before I'd had this permanent hiccups, as well as this pain in the stomach. It was diagnosed as gastroenteritis, and I was given something for that and for my permanent hiccups. The permanent hiccups finally went away, and by the end of August, I was walking about, able to get about. I went back to work. This was on the Tuesday after the August bank holiday, and I hadn't been to the loo the night in the morning, and so I still got a pain in my stomach. I think I seem to remember that happening. So whether I used to get pains in my stomach and then go to the loo, it used to go away, I'm not sure, but I remember that. But I still got this pain while I was at work, and I was there for about 2 hours. And I said to my manager, I've got to go home, and I went straight to bed. And on the Wednesday afternoon, I started to vomit green bile, bright green bile. And they called the ambulance, and they got me down to A&E. And on the Thursday, they kept me in overnight, and they did a CAT scan, and they found there was a blockage in my colon. And I had various tubes stuck down my throat in the middle of the night, into my bowel, and I was cathetered. So on the Friday I had the operation, and even after the operation, even though I was cathetered up and all tubed up, I was in agony. It felt as though I wanted to go to and I couldn't see my family till, I spoke to them. I don't think I saw them till the following day.
Hearing that about what you went through and with those initial symptoms,
yes,
getting to medical attention, how do you feel the diagnosis was handled, and how did it come about?
Well, I feel lucky, that it was found out when it did, because since I've had this, and I've read cases where people locally have been misdiagnosed, and it was found out, when it was. As I said, I've had no previous symptom except the Christmas before, when I was ill, from Christmas Day until Boxing Day, and I soiled myself in the bed, which I've never done and never done again. But that was the only symptom that I could think of. So
really, you were fairly well in yourself.
Yes, yes. But people tell me that I always looked pale.
Right.
Now, whether it was because because now I go for a walk every single day, so I'm out in the fresh air. But whether I was working all the time, but I was told, people have told me afterwards that I looked pale.
Well, that's sometimes a symptom, isn't it?
Yeah, but nobody ever told me.
Losing a little bit of blood.
Yeah, but I never had any symptoms of that nature in my, when I went to the loo or anything.
No, just out of interest, when you were on the wards, did they find that your blood level, the hemoglobin level, was a little bit low?
Not that I can remember, no.
Okay. But in any case, you'd said that you had that blockage occur, and then I think that precipitated them finding a tumour there, was it?
Well, no, I didn't know I got a blockage. They did the CAT scan, and they said there was a blockage.
You didn't know about it? They found it on the scan?
On the scan. I didn't know what was causing, me being ill. And I got no idea. I just got a pain in my stomach, so...
So how did they finally clinch that diagnosis of the bowel cancer?
I was lucky. I say I was lucky. There was only one tumour, which was inside the colon, and they took out 12 inches of the colon, and and they took out all the lymph nodes, and there was no cancer on the lymph nodes. But it took them 2 weeks to tell me that it was there was only one tumour, which was inside the colon, because there can be, and that can be treated because there's 3 types: one outside the colon and one inside, and there's a third one. And mine was it wasn't the worst one if it was inside the colon anyway.
Yes, you're talking about the staging of it.
Yeah, you know,
the type of the tumor,
yes, the type, yes.
The Duke's staging.
Yeah.
And I guess a question that's relevant is what did they tell you at that stage about the cancer and the outlook at that point?
I can't remember. I truthfully can't remember. I knew I wanted to have chemotherapy, even though they hadn't found any more tumours, because my mother had died of cancer, but that was in the 60s when, you know, times were different. But I wanted, they told us about a trials drug, and I was on the trial. I wanted to be on the trial, and
you know, I've
got involved on the trial. Yes, yeah. yes.
Do you think that was a good thing, because people are not necessarily sure whether to be involved in drug?
Yes, I think. Well, you know, I thought I wanted if I got an extra chance, you know.
Yeah. Your understanding was you'd have a better chance.
Well, yes,
with the drug trial.
Yeah, with the drug trial. Yes.
And how did that go? How did it work out? You know, when you had the trial drug.
Right. Yeah. I think it's the one side effect, but I'm still here. So you know, it was that it left me. They call it hand-foot syndrome. You get frozen feet and frozen hands, and I've still got the problems with my hands, particularly now.
Is it the sensation that's?
Yes. Yeah. And they're cold all the while. They're cold.
Yeah, I mean, I've heard that as being a common chemotherapy-related.
Yeah, I mean, Terry Jones. I remember him writing about it in the paper. You know, he'd had the same operation. So, but I did have a copy that I got through the Beating Bowel Cancer Charity from the drug company. They printed one off the internet. You know, which said it's one of the side effects.
And what was the next step after the trial drug for you?
Well. Can I just explain? I don't know whether when I started to go in chemotherapy, whether systems have changed. What you had to do was it was 2 days a week. Every 2 weeks I went for chemotherapy, and you had a blood test by the district nurse every Friday, and if your bloods were all right, you had the chemotherapy. Every Monday, the following Monday morning, you went into the Osborne building, the oncology, from 9 o'clock in the morning in one room, and there was loads of people with the same, you know, all with having treatment. And you sat there until you saw the consultant, and then when you saw the consultant, an individual nurse would go and get your chemotherapy, and you will be in there till 6 o'clock in the evening, and then you go the following day. You get there at 10 o'clock in the morning, and so sometime about lunchtime they give you the chemotherapy. And what would happen? I had like a baby's bottle attached to there into my system, and that was taken out by the district nurse on a Wednesday. But that particular part of it was I didn't like that at all. You know, it was, I wouldn't say it wasn't disorganised, but what was good about it, you got to meet other people in the same situation.
Yes,
but there were people coming from Kettering, Great Yarmouth, but it was the long waiting, you know. And
I was going to ask you about that, whether you felt that you did get the chance to meet other people in a similar situation.
It kept us going through the day, because it was in a lot of ways it was a nightmare. It was a long day. We were lucky, you know, we had to be there by 9, you know, and we were there. If we were lucky, we were home by 6, and it kept us going. We'd speak to the other.
And after a while, you'd get used to who was coming on, you know.
Yeah, on a certain day, yes, and you'd find out, you know, I was luckier than some. You know, there was this man. He'd come from Great Yarmouth, but he got cancer all over, all over his body, but for some reason they couldn't treat him anywhere else, and he had to come, a 4-hour drive to Leicester.
Yeah. I mean, I guess people have mixed feelings when they meet other people. Sometimes it's scary to meet somebody who's in a more advanced position.
I was lucky, I think, that I was under 60. I'm not sure if this is the fact, but I didn't have a colostomy bag, and everybody else in the ward, the same as me, had a colostomy bag, but I don't know whether it was to do with age or...
Well, was it because they only took a short section out for you?
Yeah, possibly. Again, that's something I don't know. I'd have to... I tried to contact my trials nurse, and she was on holiday, and also the admin lady, and she was away on holiday about this, so these are bits I don't know.
Is there anything you found out, by going through it, that you feel, well, I didn't really realise that at the time, but I now know, this is a tricky situation. In other words, are there things that you could say that new people watching this would be able to benefit from?
Well, just keep... I know one thing that I did learn, that... Again, this was after I was ill, and during I was having the chemotherapy, was that I kept a diary by the side of my bed, and every symptom I had during the day, I wrote down, and if it repeated, then I could tell the district nurse who were coming to see me every week, and I could tell them, and I think that helped.
Yes.
And and so when I went to see my consultant, a couple of weeks later, I could tell him what had happened, where I got the pain, and he could, because he told me about this thing, it will either last for 6 months or you'll always have it, and at the moment I've always had it, but obviously I think one thing I would say is to go to A&E, not to primary care. That's the one point.
If you have a problem that's quite serious.
Yes, go to A&E, whether because it was a Sunday and why we didn't go to A&E, I don't know at the time, but I'd certainly say...
With which symptom are you saying?
With this pain I had,
Yes.
Early, when I went to see them, and the hiccups,
With the initial symptoms.
With the initial symptoms, I wish I'd, gone to an A&E.
Yeah, it is an option if the things are really pressing and you feel they're very severe.
Yeah, well, I've got another story about that, but I'll tell you about that later.
Okay.
Right. But even so, with all that, during the chemotherapy, this was October, November, the beginning of December, I had to go in for a week, because I suddenly got ill, and apparently I was dehydrated. I wasn't, and had to, stay in here for a week because of that, But I don't know whether I obviously wasn't drinking enough, but I know it's taught me to. I drink a lot during the day, mostly squash and things like that. But it taught me not to
fall behind on your fluid intake.
Yes, and thanks to my GP and the district nurse, I think I got eventually the right medication, which have helped me, which have kept me going. Various things to help me sleep, and a particular drug called cyclazine, which stops me being sick. Because sometimes, obviously with a bit colon, I possibly do eat too much, but I try not to. But it stops me being sick, and I've only been sick 3 times in the last 6 years. And that's helped, and a medication for helping with my pain, which I get.
Let's think about another area, which is whether there's any restrictions now on your lifestyle or hobbies. What's the effect of living with the condition now? Okay, I know it's been treated and you're doing well, but what's the influence on your life?
Oh goodness me. I probably don't do as much as I'd like to do. I still like to go out for a walk every day, and I will walk round, but I find I can do things, but afterwards I'm tired, and I will have I'm 66, but I will have a lie down for a couple of hours every day. But I don't have alcohol anymore, but I've stopped that when I changed jobs before 2001, 5 years before. I put on about 1.5 stone, and I thought it was so I was drinking too much alcohol, and it was because I changed my job from being standing up and working a newsagent. I was sitting down all the while. And I suppose it's changed. I can't have large meals. I can't, because I know it's a habit. That if I have a plate full of food, I'll eat it. I can't, but so I have smaller meals, and, I try to be regular in my, breakfast, a sandwich at lunchtime, and a meal in the eating. And one thing I'll say that I don't know, that I had started to take blood pressure tablets, but after my operation, I was told by the consultant not to take the blood pressure tablets.
Yes.
But I'm now taking them again. I don't know what brought this on, but yeah, there is another story that comes afterwards. That I had been getting on all right. Because it was the trials. I went to see my consultants every 2 or 3 years, I think, afterwards. Because I did get a period again. This was during the chemotherapy when I went under 10 stone. I just stopped eating, and they managed to sort that out. But sort of a couple of years afterwards, I kept getting this pain here, and I'd taken a strong painkiller, and after an hour it would go away. And I told the consultant, he said, it's nothing to worry about. It's nothing to worry about. Anyway, by this time my daughter was at university, and she came to and see me one November. She said, "Dad, you're looking very yellow." I go up to the doctor's. I went to see my doctor and got a blood test. That he phoned me Christmas Eve. He said, "Oh, your blood tests were okay." And after Christmas, I got this sudden pain and started shaking. By the time the ambulance had come, I'd gone to sleep, and Sarah and I decided that if it happened again, we'd call the ambulance, and it happened the following Tuesday, and I started shaking, couldn't stop shaking, and I remember 4 hours later, I was in A&E, and what it was, I got pancreatitis,
Right.
which had blocked that, and apparently that was worse than having the cancer out. Apparently,
It can be severe. Yes.
yes, and Sarah was told, that night it was touch and go, but through various methods they got rid of the stones, because I knew I had got a gallstone, but that had been causing the pain all the time. And then I had my gallbladder out. Again, we were booked in March the 31st. I had my gallbladder out. I went to the old hospital wards at 7 o'clock in the morning, and they said, go and sit by a bed. And about 2 hours later, they came, we can't do your operation. Either the paperwork or the bloods were wrong,
Really?
and so I had to come in the beginning of May.
You'd been through a lot up to that point.
Yes.
A lot of people struggle with the psychological issues about what's going to happen in the future and how to cope with the difficult diagnosis. But what were things like for you emotionally at that time?
I think I seem to, I kind of, it took each each day as it came. I remember my daughter was doing A-levels, and she'd come and sit in my bed, and the only computer was in our room, so she'd sit on the edge of my bed doing her A-level work, and I'd help her with that. But I just got on with things, and
what about later then, when you went home? Did you suffer a period where you were quite low in yourself?
I don't. Well, yes and no. I know with the chemotherapy, there was that time when I was ill, and then I didn't eat. But sort of, there were times when I think why I wanted to speak to you. It was somebody
in the psycho-oncology centre.
Yes, in the psycho-oncology centre. It's somebody away from the family who I could speak to, and.
Yeah. I mean, do you think that's a key thing for people to have access to?
I think absolutely, yes, definitely, yes. The family are great. Have all been a great help, but it's somebody, and if things we had disagreements, Sarah and I did, about various things, and.
Yeah, sometimes the family can only deal with so much.
Well, that's it, and I was able to, come and speak to you, and able to talk about things, and I think it is. You do need that, I know, when I was having the chemotherapy, there were people there who you talked about, what was happening, and they said, oh yes, that things happened to me, so because I know one of the people who I was in the ward, with, he had his operation, it went wrong, and I saw him months later, and he had to, all his body had swelled up, he'd had to have the operation again, but he got over it, but we talked about that, and if you talk and try to boost one another, I think as much as you can, and
that's definitely valuable if you can meet other like-minded patients.
Yes, and this is why I wanted to do that. Unfortunately, I can't help so much with symptoms and being diagnosed early. It just didn't happen in my case. The only thing, there was this misdiagnosis, and I look back and think perhaps I should have gone to A&E. And
that's fair enough. What about resources that you've come across, not just our team, but in general, that you feel either were offered and were useful? The
Macmillan,
or perhaps you wish were offered more to people.
I know the Macmillan helped me financially. Actually, the Macmillan.
Did you seek the advice from the financial advisor that they?
Yes, because
they brought in.
Yeah, and we bought helped me to get a dryer, because more stuff was being washed,
so something very practical.
Very practical, and
did they help you with the benefits and the finances?
Yes, absolutely, yes, and also I'd been in a bit of and they helped me, fill in forms as well,
Disability living allowance.
Yes, and that, and so in that respect, yes, and they were a great help, because those things are, because I wasn't sure if I was going back to work, but I couldn't see it happening. But as it happened, while I was working, the whole of the business moved to Asia, so I wouldn't have had a job anyway if I'd have gone back to work. When I'd left in 2006, there were 50 members of staff there.
Where are you talking about? Which company was it?
Yeah, this was, we were outsourced for the Reader's Digest contract.
Yes.
And there were 50 members of staff there.
Really?
And when I came back, I was made redundant. And when I came back in 2008, there were 5 members of staff, and they were leaving at the end of the week. And all the other, they'd all moved on.
And the outsourcing, what were the tasks that were being outsourced? Yeah,
what we used to do, we used to answer all the letters, sent in from various customers, and deal with their accounts, and I didn't do the phone work. I didn't like the phone work. But you know, we got letters from.
So was that bit sent to India? The answering the
it was sent to, I think it was Ceylon, because 2 members of staff got to go to train people in there, because because the main offices are still in London, I know, and whether it's, you know, and obviously the headquarters are in America, because, you know, if the computers went down in America, then the computers went down in England.
All right. But, I mean, I know Reader's Digest have had a few problems financially as a company recently.
Yes, yeah. I'm
changing issues, you know, with the internet and that kind of thing.
Quite. I can. Yes, yeah. I know. The other problems we had. It tried to deal with the accounts from point of view. I know it's a silly thing to talk about, but we had accounts in Northern Ireland and in the UK, so there were postcodes, but we also had accounts in Southern Ireland where there's no postcodes.
I see.
And you had all these, and the convents they'd have various accounts in all these different addresses, but they'd all be the same ones, and that was a nightmare. But you know, but it did start to get sorted out over the time I went. It was never as bad as it used to be.
Well, that's good. So let's talk about now how your recovery was going over the time. You know, after you left hospital, you were back home. Sarah was around.
Yes, yeah.
And you were improving.
Yes.
How much do you feel you got back to the old you that was, you know, before you were diagnosed?
Part of it did, yes. Part of it did in the mind. I still had these problems with the hand and the feet, and
never went away.
And this pain in the stomach. But I think mentally, you know, yes, you know, I couldn't do things that I could do in the past, but I just accept it, you know.
Did you pick up any new activities though, you know, to replace those?
Not particularly. I can't say I did. No, I didn't. You know, I read, but I only read at night. You know, but I've always read. But I do read a lot more than I think ever I used to. Because whether it's because I'm not working now,
yes.
You know, I'm an avid reader every single night without fail.
Healthy, yes.
You know, and I'm able to. You know, I like to go to the music. You know, music people. You know,
concerts
and things like, you know, well-known people who I've not seen when I was younger, and now I'm older, you know, and I'm able to go and see them, you know, which is nice. That's good.
And what have you tended to do with yourself in the daytime as a rule?
Not a lot, actually. I have to get up. I get up. I feed the animals and get up and I get everybody up to go to college or to school, and and then I make breakfast for Sarah, and then Sarah, you know, gets up and she does all the cooking. But you know, I'm the one who gets up early. You know, I always have done. And
that's your ex-wife, isn't it? You live
yes, yeah. You know, and then she'll get up about 7 o'clock, and I'll get up, feed the cats, put them out, and you know, because we've got 5 cats. So, but the cats were a great help when I was ill.
Definitely.
They were. Yeah, there was one that passed away, Ginger. I mean, and he almost used to talk to me, but you know, there were 2 particular cats who laid on my bed, and they were such a
So you weren't really
comfort.
Totally on your own in the day?
No.
You had your cats around?
Yes, and Sarah was around as well, yes, yeah.
Another contact as
yes,
well?
Yes, yeah.
What about your own friends, and what was their reaction to your diagnosis?
Well, I haven't got many friends. I know it sounds silly. I've got the family,
yes.
And there's people I used to work with. You know, they were. I've told you that
colleagues, really.
Work colleagues. You know, and they said, "Well, you always looked a bit pale," you know, but
they didn't really keep in touch after you came home.
No, you know, a couple of them did, but you know, only because they went their different ways, and you know, and I didn't go out with work colleagues when I was working there.
I understand. You weren't socialising.
No, I don't know why I didn't, but I didn't.
No, that's a common choice.
It's rare.
So,
but I'm certainly. I think, you know, I'm happier, I think, now than I have been. You know, Sarah and I.
That's good.
You know, over the last few years, and we tried to do a few more, you know, things as they went. went to a concert in Derby and stayed overnight. We went to a play in London, which we've never done before.
Yeah.
You know,
it sounds like you're on good terms now.
Yes,
good terms.
yes. But I say, she keeps getting pains. You know,
She's had a few health issues.
Yes, you know, but she's different to me. She won't. It's a question of getting her up to the doctors into the appointment. She'll nag me to go and say you've got to go, but
she does not secure herself.
No.
That's not. Yeah, I've heard that quite a few times.
But you know, it's just the way we are. But you know, but as I said earlier, that I know my daughter and Sarah. You know, they're patient-wise, they're terrible. You know, in the hospital. But I seem to just get on with it, as I say. You know, and.
Let's have a think now about the bigger picture. So, you know, bowel cancer is one of the more common cancers, but arguably it hasn't had as much recognition as some others in the past. But there's recent campaigns to raise awareness. How do you think bowel cancer is handled generally, you know, in the media? And
well, I don't think there is a lot of it. I know. I remember one particular case of Terry Jones, and he hadn't mentioned it until after he'd had his operation, after his chemotherapy, and he mentioned the thing that I had, the hand-frozen syndrome. But there was, you know, I think we've got to be open about it, because, you know, and get these leaflets with, you know, symptoms, you know, if
the early recognition
people,
type of thing.
Early recognition, that although in my case it wouldn't have.
It didn't affect you.
It didn't affect me at all, because I didn't have any of the symptoms that you normally would have.
But there is this screening option now, isn't there?
Yes, and I think, you know, people, if they can, you know, they ought to. I know it is a bit of a messy job, you know, doing it, but you know, it can be worthwhile, you know, because I know you read cases of people who are, you know, diagnosed with bowel cancer, you know, and it's too late. Yes. You know, and I feel, you know, I'm one of the lucky ones. You know, how long that tumor had been there, I have no idea, and I never did find out, and I never also found out what caused it.
Yes,
yeah,
sometimes.
You know, anything in my lifestyle that, you know, that I could have changed. And
does that worry you?
I suppose it. You know, it would help. You know, if somebody had said, you know, such and such a thing you're eating, you know, has caused that.
Yeah.
Mind you, I'll tell you a funny story, but I didn't think. And Sarah always said that I was going on about my bowels. Now, whether that meant I was going to the toilet or what, but I never thought I was going on about my bowels. And this was before I had bowel cancer, and that's, you know. No, I don't know. That was just a joke that, you know, that she had, but you know, it sort of shut her up when I got bowel cancer. but you know, this is a true fact. You know, yes. Whether I know when we moved, we only had one loo, and when we were living before, there were two loos. Yes. You know, so that we used to sort of announce, you know, that we were
needing to use the toilet.
Need to use the toilet. Yes,
I definitely follow you there, but
yes.
Yeah, that's a funny one. So, what do you see as the future now for yourself?
You live as old as my brothers. You know, yeah, they're both in their 80s. You know, I'm the baby sibling. You know, I just want to keep going. You know, trying to enjoy myself in my later life. You know, see my kids growing up, and you know, it's all about what's going to happen to them. You know, in the future. In this country, and you know, we've talked, you know, to them about, you know, why don't they move to Australia, or you know, because of the way things are in Great Britain, you know, and but yeah, I just want to, keep going, you know, and Sarah keeps well, you know, and we find out what's, you know, all of us to keep well, really, you know, that's my, you know, and
do you have any recommendations for cancer care or cancer services in general?
I think some organisation is needed in the oncology unit, you know, at Leicester Royal Infirmary and probably other ones, because I know the chemotherapy procedure for me, those 2 days, were in some ways nightmarish, and sitting in a small room, you know, all day. But what the good thing that came out of it, we met other people in a similar situation, and we talked about our symptoms, and we know, and we were able to say, oh yes, and we've done this and we've done that. So in that respect, meeting families, you know, but it was such a small confined space, and you were just sitting there waiting, and they had to individually. The nurses bring the chemotherapy medicine across, you know, from the pharmacy. I don't know. You'd have thought there would have been a better system. I don't know, but there was one thing about this during having my chemotherapy, and it will be about this time 2007, and we had a few nice summery days, and I thought, oh, lovely. I shall sit out in the garden, you know, in you know, and I sat out in the sunshine, and in the evening I had a stomach ache, and the following day, it was a lovely day, I sat out in the garden. In the evening I had a stomach ache again, and the next time I went to chemotherapy, I was saying, you know, when we had those few nice days, I was sitting outside, oh, you can't, you know, it's you know, it's the drug I was taking, the you know, the UV rays that affect.
It caused a specific side effect.
Yes,
which,
yes.
You really suffered.
Which I didn't know about.
You didn't.
But you know, you think it's a nice day, and that's a help, you know, with, you know, regards, you know, making you feel better. But it had a reverse effect.
You wouldn't guess that, would you?
No. But I didn't think at the time, because I know when they had one of the drugs in the
IV line.
Yes. Yeah, they had black things to cover it, so it, you know.
So it wasn't
affected
altered by the sun.
Yes, by the sun. Yeah, yes.
Well, look, I wish you all the best for the future.
Thank you.
And thank you for coming in. Because
not at all. No.
We haven't actually had many people with a bowel cancer.
No.
On the video so far. So I appreciate you.
Yes. Yeah. You know, as I say, I'd like to, you know, got in touch with, you know, those 2 members of staff, just to see if any systems have changed since I've, you know, since I had mine.
Well, I'm sure if you did speak to them, they would invite you back to have a look around.
Yes, yeah. You know, I would.
Things tend to change quite slowly in the health service.
Yes.
So probably there aren't big changes, but your suggestions are worthwhile.
Yes.
And I'm sure people watching this.
Yes,
would
definitely.
Find
you know.
Your personal suggestions very valuable.
Yeah, because I know as another thing as a couple of things I want to make a point about, because I was awake all night, and I would be sitting there listening to the nurses talking, and they would get phone calls from the bed
coordinator.
Yeah, the bed consultant, or who needed so many beds.
Yeah,
and they would say, to the nurses who got the patients, they're all asleep, we need to get 4 or 5 patients out of this ward, you know, because, you know, we've got other people coming in. And, you know, I know what I would have said to any person who tried to get me out of that ward, and it wouldn't, you know, it wouldn't be nice. No. But, you know, I don't think it is good. There must be a better way.
Yeah, well, because you're observing something critical about the NHS.
Yes.
How we're trying to micromanage precious resources.
Yes, you know, yes.
Difficult.
Yes. As I say, and also, I remember not when I had the cancer, when I had the pancreatitis, they had 3 more mature ladies, and I called them the A-team. You know, it was when I was on the high dependency unit, and they got 3 specific jobs, you know, and they knew exactly what they were doing. Obviously, they've done it together for years, and they were just amazing, brilliant. They'd come and check me every hour, but, you know, I did, you know, they were just amazing.
What recommendation would you make there then?
You know, that some some person watches I don't know who they were, 3 members of staff, you know, and they knew exactly what they were doing. I'm not saying the others didn't, but you know, they will be good examples for new nurses, you know, and other members of staff to see
Yes.
how they did things and how they organised things.
Yeah, that's a good point. If their abilities could
Yes,
be
yeah. Yes,
shared
yeah.
amongst their
But
colleagues.
I also will make the point about, I shouldn't, perhaps I shouldn't say this off the record, about because my GP contacted the surgeon's secretary rather than go through
The usual route.
It took over 4 or 5 weeks to get my results.
Yeah.
And they were wrong, and they were wrong because I was ill. My consultant said I was okay, the results were okay, and I had pancreatitis.
Pancreatitis, but they were wrong about that.
They were wrong about that.
That's
So yes,
unfortunate. So you were
Yes.
subject to a delay there.
yes.
Well, if
But another point, but she's not there now. But when I was there, and when I was in the hospital, I saw a lady called Maureen Yardley who was in charge of the complaints. And I made, you know, these points to her about this and other things, and she was such a great help. I don't know if they've got anybody as good as her, but she was a lovely, lovely lady.
The key question is, did anything change as a result of that for future patients?
I hope so.
Yes.
I hope so, but I have a feeling that there isn't somebody like her, because she was a lovely lady, and Sarah got on well, you know, and she was such a help, you know, to us, you know,
Those
because we
people
weren't.
who represent the patient's views, not just complaints,
Yes,
feedback,
I know.
they are very critical.
Yes.
I have to admit that.
Yes.
No doubt about it.
Yes, yeah.
Thanks for coming in.
No,
That's been really
no, not at all. No.
all the best anyway.
Thank you very much. No, and thank you for, you know, letting me, you know, talk to you as well.
No problem.
You know, you've been a great help.
It's been good to have your account.